Chaliba is the only township with a properly equipped hospital to diagnose and treat Azar. But during rainy seasons, accessing the hospital becomes difficult for patients when river swarm bursts its banks. On average, 45 patients are admitted every month at this hospital for specialized treatment that takes no less than 30 days.
The patients that we see, they live very far away. That means that it is absolutely very unrealistic to think that if the patient is not admitted, he's going to go home and come back every day.
Sometimes a rash appears on the skin after treatment. That in itself makes a patient highly infectious and requires a longer time of treatment. Sometimes patients have to return to hospital for another 70 days. Diagnosis and treatment is complicated and requires specialized staff to administer. Azar is, however, not a strange disease here.
Kwa Pokot inaitwa termes. Na hiyo ugonjwa imekuwa hapa tangu zamani. Hiyo ugonjwa ilikuwa inashika watu na inaua watu.
Apparently, it's one of the world's most minute insects that transmits the parasite that causes the deadly disease, the sandfly.
It's between 3 to 6 millimeters.
These anthills are home to the tiny little sandflies that are almost invisible with a naked eye that transmit the parasite that causes Azar, an abundant disease that also appears almost invisible to governments and pharmaceuticals, which are yet to see the market value of investing in it.
There's not enough investment to develop new drugs and diagnostic tests. Currently, there are what we use is two drugs. And it's a drug that was developed in the late 30s, so 7 decades ago.
Doctors say Azar is the most neglected of all neglected diseases.
Because they affect populations that live in very remote areas, and basically because they don't have the money to pay for the drugs. It's a disease of the poverty.
For now, it's only the Doctors Without Borders that have made inroads into the areas where Azar is highly endemic to save patients who have no chance of survival without treatment. Richard Simotwa, a motorbike mechanic, says he was once on a deathbed.
Hiyo ilikuwa ni ugonjwa wa kuua. Because kama hujagundua inakuua. Wakati nilikuwa natibiwa typhoid mwanzo, nikamaliza dosi ya typhoid, hakuna improvement yote. Alafu daktari tena akarudi akaniita hapa akanipima tena upya. Kunipima ndio akadiscover niko na Azar.
Treatment remains the most effective means of controlling the spread of Azar. The cycle of infection is effectively cut off when a patient receives full treatment, as the parasites in their body are totally eliminated. Destroying the sandflies' habitats is quite an impossible task. People are, however, advised to live more than 200 meters away from anthills and to clear dead bugs from acacia trees near their homes. Cracks and crevices in the houses should also be sealed. Sylvia Chebet, Citizen Live at 9, West Pokot County.